All right. Good afternoon, everyone. My name is Sarah, and I'll be presenting my abstract titled Leveraging Artificial Intelligence for HIV Hotspot Mapping. We'll be looking at early insights from EPCON AI implementation in Anambra State. All right, so just a bit of a disclosure here. This work was supported by the Institute of Human Virology Nigeria and also Achieving Health Nigeria initiative under the Global Fund GC7 grants. And then the founders have, they had no role in the study design, the data collection, the analysis, interpretation, or the decision to present these findings. So for me, I also have no financial, personal, or professional conflict of interest to declare. All right, moving on straight to the abstract. So we'll be looking at the overview of Anambra State, Nigeria. So as at 2022, the population of Anambra State was 5,953,517, and then the area covered was 4,710 per square kilometer. So the population density as at that period was also 1,264 per square kilometer. So looking at the HIV prevalence rate, looking at this national prevalence, the national spectrum data, that is, we had Anambra State at 2.2%, and then we have the HIV burden of 97,430, and with the population, PLHIV population density of 19.51 per square kilometer. So, in overall, we have 21 local governments in Anambra State, and GF Global Fund is covering 213 spoke sites and 165 ART sites, and one key population one-stop shop. All right, so looking at the background, EPCON AI was used for HYW program in Anambra State, which uses machine learning to analyze our routine, facility, and community data. We use it to predict our HIV vulnerability hotspots, and it also generates our geospatial maps to guide our outreaches, our testing, and also our prevention programs. So over time, we realized that our traditional method really struggle to pinpoint the high risk areas. And even if it does, we are unable to saturate it because we would have used the limited resources into areas that are not yielding. So, but then to improve on this, EPCON AI was introduced in Anambra State in March 2024. And I'm happy to tell you that with a single click, it will rapidly highlight the priority areas that needs programmatic attention. So that way we were able to maximize and also proficiently use our resources to target the areas that are of need. So the adolescent girls and young women from age of 10 to 24 years are the ages of the adolescent that we are looking at on our grants, and that's and those that are proportionately affected. So thereby highlighting the need for gender sensitivity approaches, because we're trying to focus on the adolescent girls and also the young women, and where we can get them are probably in the schools, at homes, and also in so many other secluded areas, because they're actually adolescents. They are not adults that you can easily get to meet them anywhere. And even if you do, you also need to seek the consent of their guardian or their caregivers before you can have access to them. But with the HEPCON AI, we were able to at least pinpoint those areas, go after them, seek all the necessary clarifications we need and approvals, and then we go ahead to provide our services. So EPCON AI relied on our quantitative program data. That's the routinely data that we report on a monthly basis, weekly basis, and daily basis from our DHIS, which is a District Health Information System, DHIS2, and also other programmatic sources. So we also have for that kind of data to be reported, nationally, we have some data collection tools that were nationally approved. And it is not only pertinent to Anambra State alone. All the 36 plus one states in Nigeria are using this tool. So that's why we call them the National Data Collection Tool. So under that, we have the HCS register, which is able to capture the age of the clients, the demographic information, the status of those clients, and some basic information that we need. So these are part of the information that we fit into the EPCON AI that help us to generate the information that we need. So we have the client intake form as well, which is also used for testing. So whenever we are conducting any test or anything, we must first administer the client intake form, because it's inside that we have some questions that we need to ask those clients, those people, before we go ahead to do any form of testing or to provide any services for them. So we also have our prevention registers. We have the facility and community intervention reports that also fits into the EPCON AI. That way, it will be able to guide the information that we are generating and what we need it for. So majorly all the data were identified and aggregated at the local governments and ward levels. So the AI platform then generates hotspot maps, which is being informed by the historical and current program data that we have keyed into the platform. So that way it gives us a concise information and accurate data, and the data that we can all rely on. So that way we know that any information we have on our DHIS2 is also replicated on our EPCON AI. So what are the results so far? We've really noticed a huge turnover from, if you look at the first point I have there, between 2021 and 2023, that's about 3 years, we only achieved 234,170 AGYW that were tested for HIV. That's giving us 77% of our targets. And while 485,190 AGYWs received prevention packages, surpassing our targets. But now, with the introduction of EPCON AI, our testing uptake in 2024 to 2025 July, to be precise, that's just about a year and 5 months. We've been able to triple whatsoever thing we achieved for 3 good years. We reached 329,991 clients on prevention, on testing alone. And then we distributed prevention packages to 666,408 clients as of July 2025. So without the EPCON AI, the resources would have been spread across low-yield areas with limited impacts, and will not be able to measure or achieve this kind of performance that we've been able to see over just the period of few months. So a year and some months. So for us, it's a huge traction. We don't take for granted, but to give kudos to the EPCON AI that has always been the support needed for this kind of program implementation. So we also achieve real-time mapping, which minimize delays in our decision making and also strengthen our program responsiveness. So we don't have to wait with just a click of a button. We know where to go to on a daily basis, on a weekly basis, and also on a monthly basis. For each person, for each clusters, they know where to go by the time they look at the report that they have, and they are able to channel all the resources and energy into achieving what is expected using the EPCON AI. So in conclusion, the introduction of EPCON AI in Anambra State demonstrates the transformative role of artificial intelligence in HIV programming by enabling our predictive modeling and dynamic hotspot mapping. And then our EPCON AI also helps to enhance our precision, optimize our resources, and also improved our outcomes for AGYW. Before, we were struggling to achieve our targets on AGYW because of those concerns I raised. The first one is that we don't have express approval to reach out to the AGYWs as of the adolescent girls and young women without seeking the consent of their caregivers or their parents. But this time around with the EPCON AI, even if we are seeking that kind of approval, it helps us to target it. We can either go for a school outreach or go for some other activities that we know that require minimal interference from their caregivers. So we also we with this we also we've been able to have a data driven approach that supports our epidemic control, which is actually the bone of contention here, just to reduce the spread of HIV AIDS in Anambra State. So we've been able to use data to drive our approaches, and it has also been able to offer a replicable model for other high burden settings. So even though we are looking out for AGYWs, as much as we can, so we also try to target their guardian, their parents. We try to target their social contacts, their biological contacts. That way we are not only strengthening AGYW alone, but we are also bringing up other implementation, other programmatic areas that we can use to reduce the spread of HIV/AIDS in Anambra State. So the future priorities that we are looking at here is for us to strengthen our data quality, expand our algorithm scope, and also embed EPCON AI with broader health systems for sustainability. That way we know that even if Global Fund decides to leave the states for now, we can easily hand it over to the states, whereby they can also continue from where we stop. That way they know that it is a system that is already running, no need for interference except for the data that is supposed to be fed into the HEPCON AI. So that way we know that whatsoever thing that is coming out of the app, it's of value, it's reliable, and it's something that everybody should be able to work with. Thank you for listening.